Hi, I'm Dr. Brian Thornburg, and this is part 2 on how did we end up in this catastrophic food and medical crisis resulting in metabolic disease. And I finished that Harvard Medical School didn't even have a written exam because most students didn't read or write until 1865. So let's advance a little bit more. So now we had 400 medical schools in the United States at the end of the 1800s. It was a Wild West, essentially. Basically, there was no formal coordination to training, and if you decided that you wanted to become a doctor, you could just hang a shingle. So it was understandable that we needed some type of regulation, and this is where the Carnegie Foundation and the Rockefeller Foundation step in. They provided, in what is today's dollars, $7 billion to rewrite medical education. At that time, in the 1800s, there was a growing movement towards scientific method. Double placebo, randomized controlled studies. Louis Pasteur had just found the cause of infection, and so there was a growing movement to standardize medical care, and it came out of Germany. And so Johns Hopkins was the very first school in the United States that provided a scientific method to their education. So they bring back the Rockefeller Foundation with their $7 billion in today's dollars. They rewrote medical education by using Abraham Flexner, who was a high school principal from Louisville, Kentucky, to determine which schools and what programs would be considered to be allowed in the United States. So at the end of the 1800s, we had 400 medical schools. By 1935, there were only 33 medical schools.